Good morning once again. It seems like I just saw you a few minutes ago. I want to welcome all the attendees and welcome our support staff from Eva Emma over here on the side, and Paul Flannery. Paul, you want to lean in and say hello as our support guy here? I introduced him as Cecil D. Flannery earlier on, and he's going to be here to handle any glitches that, for instance, just occurred. And I will ask you, as I said earlier, if you've not been one of those people that have been dispatched to Ice Station Zebra in the polar ice cap, or you have been invited to Paul's private estate off the coast of Bora Bora to join him there in isolation, then is there anyone out there who hasn't in some form or fashion been affected adversely by this pandemic? And reflecting back, it's interesting what's happening in our marketplace today, because COVID in itself has had an interesting effect. It's created a windfall in the yachting business as our end users seek isolation in a healthy environment. Sales and charter are on record-setting paces. The marked increase in recreational and yachting has made it more acutely necessary that we're able to provide for healthy and safe environments, and that is the purpose of this webinar. So let me continue on by saying that there's been a lot of talk about what's going on, but there's not been a preponderance of talk about what the solutions might be, whether you're a charter manager, whether you're our crew. And I noticed in going over our attendee list, there are a lot of crew looking in, a lot of captains, a lot of owners, yacht brokers. All of us have been affected in one way or another. And we're here to talk to you today about what can be done. I'm Bob Saxon of Bob Saxon Consultancy. My pin over here, actually, on my jacket, says EVA. I'm president of EVA as well. And we're going to talk about the whys, the wherefores, and how-tos of pandemic issue. And joining me today for this discussion are two individuals immersed in the subject. And to my left, or to your right as you're looking at it on the screen, is Mark Bonini of MH Insurance Providers. They are acknowledged leaders in crew and healthcare solutions. And Peter Holt, to my right, to my left, as the screen shows, CEO of VIKAND, also acknowledged as pace setters for providing public health solutions for the luxury cruise line industry and now yachting, from whom we can learn much as applies to our particular yachting market. I think that you'll observe that the dynamics between these two providers is very interesting in terms of the synergies and how this coupling of the insurance along with the solution provider creates a lot of dynamics. The objective of the webinar, I don't see the screen up there, but I'm just going to briefly say COVID, how to protect from COVID. What if we get it? What happens? How does COVID affect me? What tools are available? And what happens on my vessel if COVID is present. So a quick formatting, I mentioned that I don't want you to think of the recent political debates. There's not going to be one of those debacles that we have here, that we have a lot of shouting back and forth, but it's more of an information delivery. There will be chat questions that you can submit to us, although I will say that we've had over 100 chat questions already submitted within our discussion today. I think a lot of those will be answered, but we look forward to you giving comments or chats that Paul's going to monitor for us. There will be relevant links that we'll talk about later on, and a recording of this session will be available on the EVA website, as well as VIKAND and presumably the MHS website. So let's get on with this now, and I want to ask a general question of you, Peter. What are the major issues that you see in the yachting business at all? What are the concerns for crew, for owners, guests, their guests, and charter clients?
Well, thank you, Bob. And can we move the PowerPoint to not that slide, but this slide? Yes. So in many ways, the yachting industry is just slightly behind where the cruise industry and the maritime industry in its response to COVID-19. There is best practices that has been created in the maritime industry and is just about to become the standard, which we think is going to be validated by CDC in the next week or two. Those best practices, we think, will be very useful for the yachting industry in many ways. And we have recently seen in several yacht forums, yacht captains actually referencing the work that has been done in the cruise industry. So in many ways, we're looking at the best practices from the travel industry. And I think the biggest and most important thing we can do in the yachting industry is to protect the crew, the owners, and the charter guest, as well as anyone else that is coming on board the yacht to visit, right? And there is a couple of very simple steps that we need to deploy to make this happen. First of all, let's avoid bringing COVID on board.
Okay, can I interrupt you for just a second? Because I know exactly where you're going, and I want to make sure that we go there. And that is this, from beginning to end, the engagement of the client that's going on board, or the owner, or his guests that are planning to go on board a yacht. Give us a little walkthrough, a day in the life of the yacht user.
Thank you, Bob. So if you have a guest or a crew traveling to the yacht, the number one thing that you need to do before you set off on your travel is to get a PCR test and be negative the moment you travel to the yacht. During your travel with a negative PCR test, you need to make sure that you practice all of the sensible approaches with social distancing and PPE. If you're on an airplane, make sure that you protect yourself with masks and so on. You getting to the port where the yacht is, now you need to be sure that you test it again before you join the yacht. There's different ways of doing that. We're going into an environment where you can actually have your own PCR testing on the yacht that you can do on the spot testing for your guests, for your crew, or anyone that wants to come on board to have a glass of wine or spend some time with the charter guest or the owner. We see into the future, coming up in about Thanksgiving, a breathalyzer test that will make this process much more convenient and easy and less invasive, where you basically are blowing into a tube as you do with an alcohol test, and you will have a response within a minute at a higher degree of accuracy than a PCR test. That is going to be a game changer in the yachting industry. Then you're moving on board. There's three really important aspects to when you're on board the yacht. Sanitation, sanitation, sanitation. Air sanitation, surface sanitation, and cross-contamination, bundled with training and protocols. We all now know that COVID is an aerosolized transmission. With that, we need to deploy the most effective air management controls available in the industry today. There's a great tool called Pure, which is the only FDA-approved air management solution available today that can be deployed onto a yacht and will not have any impact on the yacht's operation. We then move on to early identification. If you have a suspected case or a case of COVID on board, you need to identify it. If you don't identify it, you need to report when you come into a port and the vessel may be quarantined or isolated, which have a big impact on the crew, the charter guest, and the owner. By doing early intervention, you know if it's flu or it's COVID, and if it's COVID, you can then handle that appropriately and work with the local port authorities and health authorities to make sure that you manage that case with contact tracing and so on. So this is the lifespan that you have when you deal with coronavirus today. The bottom line is we need to avoid having coronavirus on board. It is deadly, it is dangerous, so we need to put all the protections in place to be able to do that, wrapped in protocols. And I know that Mark would absolutely agree with that, because in many ways, MHG is the direct responsible party when somebody gets coronavirus.
That's a good introduction, a good segue for me to talk to Mark here about how insurance will play an integral and critical support role in all this. Can you comment on that, Mark?
Sure, absolutely. Well, the most important thing, as Peter alluded to, is to try to prevent COVID to come on board. It may simply not be possible to do that with 100% success. So we are here to help and assist in terms of providing you with support when that happens, and that includes obviously the insurance component to provide the coverage for the medical care that you may need or that your crew may need, and also to provide support in terms of other protocols that various health insurers may recommend, and also to just give you guidance on proper procedure going forward. And really what we're all about is just trying to minimize the impact as a whole picture of a coronavirus case on board the yacht. And so that includes not only the insurance component, but also just managing and triaging the case as quickly and as effectively as possible.
So there was a question that came in, and then that's specific to an outbreak on a yacht. What if a crew, in fact, has a individual outbreak on board the yacht? What happens with the insurance, the crew insurance that they have, personal, medical, and health insurance, and all that? Mm-hmm. Have the products differed now because of COVID, or are these solutions and remedies and cures, as they call them, built into the existing insurance coverage for crew?
That's a great question, Bob, because ironically, just yesterday, we had yet another insurance carrier change their program. And so it's still even 7-8 months into this pandemic, a dynamic situation where we have various insurance carriers that are adapting, changing, some for the better, some for the worse. And so it is definitely something that you really have to stay on top of as a captain, as a vessel owner, as a yacht manager, to make sure that you are aware of the coverage that you have or the coverage that you don't have on board, so that hopefully you can address that before it becomes an issue where you find out that you don't have the coverage that you thought you did. So yeah, that it's definitely being addressed globally by insurance carriers. And again, some are negative, some are very positive, and they're covering it carte blanche. But it's still a dynamic environment.
Not only in terms of the individual crew coverage that might be acquired as somebody becomes employed or is an independent contractor, and they seek you guys out to get that coverage and all that, but also, and I know it's not your field, but also a consideration for everybody to think about is how the hull coverage and the cures that are provided for mariners and seamen in the hull coverage under the Federal Harbor Workers and Longshoremen Act and such are also interesting, how those dynamics come into play. So I only mention that so that those of you that are out there can think about this, you captains, what kind of talk is there, what kind of language is there in your hull coverage on the yacht? So Peter, VIKAND has had some impressive experience in the luxury cruise ship market. That's apparent. Can you give us an overview of what's being done there and what you've accomplished in the luxury cruise ship industry and how those products are being refined and defined for the yachting industry?
So yeah, I kind of alluded to that earlier on, but in the cruise industry today, there is an incredible amount of knowledge and experience from managing COVID-19 from the many ships that had outbreaks for COVID back in March, April, and May. Through this past 4 or 5 months, through an incredibly strong partnership with public health officials, CDC and FDA commissioners, best practices has been created to be able to create safe environment on those ships. And that's where we're coming back to testing before you come on board, at-home testing, in-terminal testing, or before you're boarding testing, being able to quickly and rapidly identify cases on board to minimize the spread on board. So identification of suspected or confirmed cases is critical. Then provide the proper management around that to be sure that you provide them both the right medical care, but also the right support when it comes to port and health authorities to make sure that you don't impact the vessel, basically putting them in quarantine for weeks on end. And then deploying technologies that will resolve and provide mitigation on board. And again, it's coming back to the cross-contamination, which is really about hand washing and protocol and training, surface sanitation, which we're all doing, but try to use non-chemical based, high efficacy based surface sanitation technologies, air sanitation. It is the most important aspect of managing COVID. So if you, first of all, try to remove and don't bring COVID on board, but if you have COVID, then you'll want to make sure that you have the greatest and most effective air management system on board. If you have COVID on board, the protocols have to be strong to be sure that you isolate and do contact tracing really quickly, which I know is a challenge in the yachting industry, but we have created customized protocols for the yachting industry to be able to handle this, both for the charter yachts as well as for the owner yachts as well. So I think we're taking all of those experiences from the luxury cruise market, and we have a lot of very unfortunate experiences from the cruise industry.
One of the things that I was just going to comment, Peter, is that we have seen obviously an enormous increase in the number of people who are being tested for coronavirus. And one of the challenges that we faced on the insurance side is 7 out of my 14 crew have tested positive, but none of them have symptoms. Who's covering the cost of isolating these folks? And the insurance companies are not, because they're asymptomatic. However, proper protocol is that you've got to isolate these individuals, get everyone tested, and you know, that side of thing. So it is really the air component of it is really important.
Yeah, and you should try to avoid get to 7 out of 14. You try to find it when you have one, isolate them, and the best way to isolate them is actually get them a hotel shoreside and get them shoreside, get them away from the yacht as soon as possible.
So you've been dealing with this specifically as far as outbreaks on board yachts. Is that my understanding?
Yes.
With crew?
Mhm.
So can you give us one case example of a crew that had an outbreak and how you responded and what the insurance company, what role you played in that?
Sure. So the first thing we do is we get the call that says, well, this has happened, and you know, we didn't want it to happen, but this is what's taken place. You know, the biggest challenge is that we don't have very good contact tracing, as you probably are aware, and so we don't really know how it got to the person who got the infection. So that makes it a difficult process in terms of trying to isolate, you know, where the resource is. So everyone has to be tested, basically, that's on board. That's really the first step. As soon as there's a case identified, everyone has to be tested immediately. And that person who is positive, of course, needs to be isolated. The next thing we have to do is a lot of communication potentially with the yacht management company, if there is one involved, but definitely the vessel owner representative or the captain, just to run through the quick protocols of, you know, what's the process look like now in terms of the insurance? Do they need to be admitted to hospital? If so, which hospital do they go to? If they don't need to be admitted to hospital, then, you know, can we send them home? Well, if that includes a plane ride, absolutely not. And some of these silly questions that you think might be silly, but these are questions that we get. Well, can we just put them on a plane and send them home? No, you can't do that. So those are the kind of things that we address when we first find out about a
I
case.
think Peter's chomping at the bit to say something about this. And I like that, actually. Peter?
No, it is a real challenging situation, right? And so for us, it truly is. If you have those situations, you need to disembark them as soon as possible, but you also need to have access to a medical network. So there is a medical network being created in all of the ports around the world where we have contracted with medical facilities to guarantee access to COVID-19 patients.
Presumably these ports are consistent with yachting destination ports.
Right.
Yachting destination, we actually do it for the entire maritime industry, commercial shipping, yacht and cruise industry. And we do the big concentration, and frequently they are actually do overlap as well.
Yeah.
At our last seminar we did during Yacht Sales and Summit, we brought up a point about the best practices of cruise ships, the luxury cruise ships and such in the commercial sector, and how they've jumped ahead of the curve in terms of establishing those procedures before those procedures are jammed down their throats. And here's what you have to do. You are putting good practices and best practices in place. And the yachting industry can learn a lot from this, because right now what you have is there are no established procedures. And somebody wrote in a question, what are the established standards and procedures for yachts? Well, there are none. What's being imposed upon the yachts right now is only from island groups and ports, chartered port destinations, and what their expectations are in terms of pre-testing, arrival. I see that the Bahamas, I believe of Bahamas, maybe it was USVI, that came in here and said that on a 7-day charter, you must test your crew and your passengers 4 days in. Well, that was just some kind of arbitrary thing they built in, which lends me to the point about at what point does it become less than a pleasure experience for the end user, for the yacht, and having to conform to testing procedures, masks, all these other regimens. And that, so we have to somehow make this so that they still want to use the yachts, and that the steps that they're taking, you talked about the breathalyzer and the non-invasive testing and all that. So we can take a lesson from the cruise lines, I believe. We can take a lesson from what VIKAND is done with the cruise lines and start to refine those products for the yachting business. So there was one,
Sorry,
sure. Please interrupt.
So the cruise industry and the maritime industry as a whole is generally very lucky because we can create standards across the board. The yachting industry is not structured in such a way, but that doesn't mean that we don't have standards that we can follow and we can draw from the best practices in other industries.
Mm-hmm.
And that's why I'm incredibly pleased to see these yacht forums, where I see captains referencing the Healthy Sail panel of the cruise industry, and that we use those protocols refined to be sure that they make sense for the yachting industry. Testing 4 days in, I mean, you should do ongoing testing, but the goal is to test before you come on board the yacht and avoid having COVID come on board the yacht. Now, when you're on, you're going to go to the restaurant, the bars anyway. So creating a test environment that is convenient and non-invasive is a critical
Critical,
component. Today, may I just talk about antigen, PCR, and so antigen testing is a very quick and easy testing technology today. I think most companies out there are using antigen. The problem with antigen testing is that it will only test positive if you are symptomatic. It's not a screening tool. If you're negative with antigen testing, there's a 30% fail rate, meaning that you can still be COVID infected. PCR tests have a much higher accuracy, much higher, it's considered to be the gold standard, but you have to poke around in your nose and your throat, and it's expensive, and it can take a while before you get the results. There are now point of care PCR tools where you can get PCR testing. You can do it at the gangway. It's a 15-minute processing time. There's just a lot of pressure on this technology. The future is breathalyzer test, and that's going to change the totality of the dynamic in the yachting industry and in the travel industry. We are just a few weeks away from having that available.
Let's talk about crew here for a second again, not for a second, but actually longer, because I think it's so important. And we have a slide that you all can see up there. And I want to talk about the riggers. I've never been a crew other than being a fish mate for my dad on his boat in New Jersey. But other than that, my crew experience is nil, but I've certainly dealt with enough crews to know about the rigors of being a crew on board a yacht. You start out, of course, living in very confined quarters. You are on call 24/7, and sometimes you have to be in a very subservient kind of a role at times and all that. So already there is this stress built in. You don't get to go home at the end of the day, lock the door to your office, and that's it. You come back tomorrow morning. You live with the crew. The captain is becomes more of a father confessor or a family partner. They all watch movies together. They all had dine together and all that. Then they open the door back up and go back to work the next morning. So already we're beginning with a very stressful situation, and it shows with our crew a lot of turnover and all that. But I also want to mention that the mental health, if there was one common concern voiced in this list of 100 questions, it was the mental health concerns for crew. How are we addressing that? I'm going to start with you, Mark, on that, if we would, please.
Sure. So it is a very big topic, one that MHG has been working on since prior to the pandemic, and all it's done really is magnified the importance of it, of focusing on the mental health and wellness of the crew. There are a number of different resources that are available, but some of them are at no cost, some of them are available at cost, and then of course you also have different levels of solution to provide in terms of mental health support for crew. One of the things that Peter will mention is what they have called the MAP program, which is really a more comprehensive mental health solution, rather than having a situation where it's reactive, where you already have a crew member who is struggling with mental health situation. Maybe they don't feel comfortable speaking in the crew environment. They don't feel comfortable speaking with the captain because they feel they may lose their job. And so the pressure builds, basically, is what happens. And then when just before the cap pops off, that's when they make this last desperation call. And the key is not to get to that point. And so what we want to do is we want to address it immediately. We want to address it from resources that either the employer may be providing or that a third party may be providing, or something along those lines to help the crew to cope with this environment, which is even on top of, as Bob said, just the standard stress of the yacht environment. So I'd like to let Peter chat just a little bit about the map.
Yeah, just I would add, it's not all Captain Sandy Yawn, who's a good friend of mine, and the Down Under situation, as you might see. There is a little bit of that, I'm sure, in the drama and all that, but the rigors of being a crew are well known, and that's why you see so much turnover in crew. Peter?
Yeah, so I think Mark stated it correctly, right? It's pressure. And so if you look at mental wellness as a balloon, you keep on blowing up the balloon, you keep on blowing, eventually it's going to explode. What we need to create is an environment where you can let a little bit of air out. And by doing that, you're able to sustain for a longer period of time. Stigma is another big problem with mental health. And we need to stop thinking about mental health as something that is undue and bad. We need to start thinking about it as the common cold. So if you have a cold, if you don't take care of your cold, you take vitamin C and you try to take care of yourself, that cold may become pneumonia. Same thing with mental wellness, right? if you're starting to feel a little blue, if you're starting to have concerns, issues, that is the time when you need to position yourself to improve your mental condition. It's just as a cold. It's nothing more, nothing less, and we should never create this stigma around mental wellness.
Yep.
So what we're doing, Mark is absolutely correct. There is a corporate approach to mental wellness, and there is more of a charity approach, which generally is available when an owner has not provided a solution for its crew. So what we've created is a dedicated, customized maritime mental health program that provides the 24/7 call line for the crew and the captain, but also provides all of the support. In addition to, if I am a crew member on the yacht, my friend Mark, who's normally really happy, he's coming up for lunch all the time, suddenly decides not to join me for lunch anymore, trying to hide away from me, I might just be concerned.
Yeah.
We have created a solution for concerned colleagues to call us so we can reach out to Mark to talk to them. We're also providing a lot of tools, training, education, both for the captain and the senior officers on board, as to how they can both identify and support somebody who is in distress. Self-assessment tools. These are subtle, we provide them on board, but self-assessment tools that maybe help you identify yourself that you may be going down a path of a challenge.
That is one that's hard to pick up on sometimes.
And then you have the crisis management. There is stressful environments. So we provide crisis management and stressful training as well to be sure that everyone can cope at the end of the day. This is really important. This should be proactive. It should be engaging. And we don't want to have these situations where people are coming to a point where they don't know where else to turn. Yeah. We have a lot of experience with this. Unfortunately, we've seen it way too many times. Yeah. We have a great team with maritime psychologists. I'm being told I'm not being allowed to be too passionate about this. This is important. So whatever you can do, try if it's not with VIKAND, you need to create an environment where you have access to structured mental wellness support.
What does a typical crew policy say about mental health? So a crew comes to you and the owner said, look, I'm not going to put you on my company plan, but I'm going to give you a stipend and you can pick up the premium. I'll pick up the premium for your individual crew coverage. What does it say within that policy for that individual crew about mental health?
A few years back, I would have said that it says nothing or very, very little. Again, because of the change in the awareness and the perception of mental health in the yachting industry, the insurance providers are following suit. And so now you are seeing more and more coverages being included within the standard.
I think we're back on. Yeah, we're back on.
So I was talking about, I don't know where we got cut off there, sorry about that, but the stigma associated with mental health, but also the yacht's reputation should there be an outbreak on a yacht. And I was alluding to a outbreak that some chefs were bringing back to charter yachts in the Caribbean that they were picking up at fresh produce markets in the Caribbean. And so I wanted to just reflect on that, because those yachts, for all intents, became blackballed in the industry. And as far from a charter perspective, because they just carried this stigma with them and all that. The reverse of that, of course, is the positive influence, positive public relations comment that a yacht is making by having established standards in place and protocols in place to minimize the event of an outbreak, but also to add to the overall pleasure use of the yacht. Peter, you mentioned something about pure. What is pure? And it's not spelled pure.
No, it's not.
P-Y-U-R-E. Okay.
So Pure is an FDA-approved air cleaning technology, air sanitation technology that introduces basically hydroxyls into the indoor environment of a yacht.
What is a hydroxyl?
Hydroxyls is a naturally occurring oxidant that is being produced when the sun is hitting the Earth atmosphere. We have a technology that replicates what the sun is doing when it hits the Earth atmosphere. Hydroxyls is what cleans the environment outside. Unfortunately, we don't get to see those hydroxyls indoors. So this is a technology that brings those hydroxyls from the outdoor indoors, and we create an outdoor environment indoors. What hydroxyls do, they kill aerosolized viruses and bacteria in minutes. So a coronavirus will be killed at 99% within 10 minutes. It is not ozone, but it's similar to ozone. The difference between hydroxyls and ozone is dangerous. Hydroxyls are not. And hydroxyls are 1 million times more effective in sanitizing an environment. So Pure is the most effective air management system today. If I can just step back on the mental health for a second.
I'm going to ask you a lay question, okay? But go ahead. You've got the mental health.
I just want to highlight that even though if a yacht owner, a yacht management company would deploy a mental health company, confidentiality between the crew and the program remains. So no information is ever going to be transmitted to the company. There is full confidentiality, so there's no misunderstanding around that.
Yeah. One other comment that was made, and I'll get to this in a second, but one other comment that was made in the comments that I read was all vessels, especially charter vessels, this came from one of our esteemed charter managers, incidentally, as a chat, should have a set of procedures in place. And right now they do not. I'm so surprised that the flag states haven't stepped up and imposed a set of regulations and rules on the yachting industry on how these things will be handled. I'm surprised that MCL, for example, hasn't triggered something with them, or IMO. But the industry then has this opportunity to develop these standards and procedures and present them back out to the professionals that are doing this business, and establish this so to ease the mind of our crew, our owners, and our end users and all that. So,
and on that, just again, the cruise industry are now requiring cruise ships to have air management systems on board that will reduce the viruses and bacteria on board.
Yeah.
And for sure, we see this, and we see it coming in the yachting industry. We work with several big boats, and this is a really important aspect to reduce the spread and infection rate on board, improve the air quality, as well as it kills mold.
I was just going to say that we're not talking about just COVID. You know, we're also looking at what other illnesses we can prevent on board. As obviously as an insurance professional, what we want to do is minimize the impact on premiums, minimize the impact on claims, minimize the impact on how long a crew member might be unfit to work. You know, there's a number of different things, and all of those factors play into a clean and safe environment.
Yeah, you're right.
Yeah.
So that it's interesting. I was just going to go there. What about beyond this? We had at our yacht sales summit, we had Sean Cassidy join us, and Sean Cassidy said it's not just COVID, it's beyond COVID. It's what's the next outbreak? What is the next fever that's going to be created? So it's this business of chronic disease management becomes a role that you will play, and a role that we can in terms of crew wellness, loss prevention, which I want to talk about just a second here. In terms of loss prevention, what would you predict for owners of yachts in terms of their policies and or crew policies and all that might be the effect if somebody has a loss prevention program in place?
Yeah. Well, it definitely, as time goes on, you know, it's certainly going to show well, whether it's the whole policy or whether it's the crew medical policy. You know, the longer you can go without having significant history of claims, the better you're going to perform in terms of your premium adjustments. And also, you know, you'll have just a better overall environment for the crew. You know, if you continuously have illnesses on board, you're going to have a lot of crew turnover. That crew turnover ties directly to the owner's experience on board the vessel. So there, you know, there are a lot of different factors that are impacted simply by how well the vessel is managed from a health perspective. It's not just about the insurance.
Yeah, I want to take that and take something that Bob said earlier on. Reputational value is critical. So if you reduce the number of the medical incidents on board, and God forbid if you have a COVID outbreak on board, there is a reputational value. There's a reputation from a yacht perspective, yacht manager, the captain. But in the cruise industry, we all have heard of norovirus.
Mm-hmm.
When you're at Royal Caribbean and there is an outbreak on another ship, not Royal Caribbean, the guys at Royal Caribbean are going to say, look at what happened to my ship.
Mm-hmm.
Because it has an impact on the industry reputation. Right now, the yachting industry is considered to be a safe environment.
Right.
Let's keep it that way.
That's exactly right. That's exactly right.
From the Department of Shameless Commerce, I'm going to mention that that there is, I think that your services and products are so complementary. I believe that you have actually decided to partner up in providing this total healthcare solution. You want to talk about that for just a second?
I'm going to pass that on to Mark.
We have a
Sure. So the reason why we feel so passionate about this is because I think everyone cares about the crew, but VIKAND and MHG, that's who we are. We care about the crew. We want the best for the crew and of course the owners and the guests. And so what we've come to do is we've come together to basically create a total package solution where you've got hopefully every effort being made to prevent the COVID case coming on board, to prevent mold or reduce it anyway, to prevent other illnesses that can be introduced on board, but then also to have the insurance and coverages that you feel are necessary so that if you do have a condition on board, that it's addressed correctly and appropriately to mitigate the risk of potential financial losses, potential liability of losing your reputation of the vessel, obviously potential lawsuit. You know, there's a lot of different things that can happen. And so by partnering with VIKAND, we feel like we can really provide that full circle of health and wellness protection.
Okay.
Totally agree.
Enough said. So let me ask you just a couple of kind of like rhetorical questions. Peter, what keeps you awake at night? It's not that midnight cup of coffee. Okay.
Really, not keeping me awake, but what makes me frustrated to the point where I can't go to sleep is stupidity.
Yeah.
There is stupidity out there right now where there's tools, there's approach, there's access. We can do a lot of things to protect ourselves, protect our friends and colleagues, organize ourselves. Stupidity is when we don't deploy those.
Mm-hmm.
So for me, it is very frustrating to see what's happening out there and people getting severely ill, sick, and potentially die as a result of that. So that for me, Bob,
Okay.
is what's really driving.
Same question, Mark.
Yeah, for me, it's the invincibility feeling. Crew, you know, especially young crew that are in their 20s, they're invincible, right? We see it all the time when they show up in the ER, strangely enough. But invincibility is probably the thing that keeps me awake at night. Is that it's similar to what Peter is saying, is that people say it's not going to happen to them. I'm not going to get sick. Well, it's not always about you anyway. It's about your fellow crew. It's about the owner of the vessel. It's about the chartered guests. You know, just because you might not get sick, you may be costing them their life. And so that's the thing that always keeps me awake at night is what are my crew doing out there that they shouldn't be?
Well, stupidity implies that people know about it, but they care not to do it. They care not to face it.
Right.
And the ignorance part of it is like, we didn't know about this.
Mm-hmm.
And of course, that's the purpose of this webinar today, to advise you and to give you this information that you can exercise in your own particular situation. And the last question I have for you, each of you, and I'll start with you, Mark,
okay,
is what is the one takeaway that you want the attendees, if you could say one thing that they should take away from this webinar, what would it be?
Prepare prepare for not having COVID on board. And that means proper protocol, following procedures, making sure that you know where your crew are, where they're going, where they've been, and making sure that you have everything in place that you think you have in place so that you can provide a safe environment as possible on board the yacht.
Peter, what's your one takeaway?
He took it from me.
Stole it from me, all right.
The bottom line is risk mitigation.
Yeah.
Avoid getting COVID on board. That is the best approach. Best cure is to avoid having it. So prepare for that. If you do get it, make sure that you have the right support to manage it when you have it on board. So those are the two things: prevention and manage it when you have it.
I want to thank the attendees that joined us today. I think we had over 100, did we not, Paul? And Emma, for your support here as well as we handled some last minute crises. But special thanks to my panelists, Peter and Mark here. And I want to invite you to revisit this. It would probably, the recording of this will be available at the websites we mentioned earlier. It makes a great tool for your next sales meeting when you sales managers are trying to think of something to say. You can throw this up there because this becomes a tool for brokers, and more brokers are being asked about this by potential clients, and all of a sudden there are some solutions you can speak of. And with that, I will wish you all very well. Paul Flannery, thanks for your help here today.
Thank you, Bob.
And all the best to you, and stay vital.
Thank you, everybody.